We're talking about the clash between Republicans over the Paul Ryan health care plan. Donald Trump caught in the middle, having endorsed the plan maybe before he read it. I doubt that he still has. I doubt that he's read it yet. And in the meantime, they're making their whole argument based on the case that Obamacare. They've got to do something because Obamacare is failing. Obamacare is collapsing. It's imploding. What's the truth? Let's find out from Kevin Griffis, who is former Assistant Secretary for Public Affairs at HHS. Hello, Kevin. Nice to see you.
Nice to see you. Thank you for having me on.
When were you there? Why'd you leave?
Well, I left because of an event on November 8th.
Something happened on November 8th, right?
Yeah. So the shelf life for political appointees obviously lasts as long as the president does. So Barack Obama left, so did I.
So you were there under Secretary Sylvia Burwell?
I was.
And Kathleen Sebelius as well?
That's correct.
Yeah. So what is the status of, if you were a doc and you put the stethoscope to Obamacare, what do you find today? Any heartbeat at all?
The heartbeat is just fine. I think what a doctor might say is that it needs a little bit of a tune-up. And I think that's what people on the left and the right, they're healthcare experts from across the spectrum, would say. We need to make a few changes, some adjustments. The president himself laid out a series of ideas last summer in the Journal of the American Medical Association that would help fine-tune it. And that's usually what happens with a big piece of legislation like this, happens with Social Security Act, happens with the Medicare. Congress finds what's working well over time, what's not working as well, and how do we fine-tune it? And that didn't happen with the Affordable Care Act. Instead, what we've had really were attempts over time for Republicans to try to undermine the bill. And we also saw that at the very beginning of the Trump administration, where the executive order was passed, which created a lot of confusion among enrollees about whether or not they could still have health insurance. And then they also took down all the advertising for in the last week. And the last week is really when you're trying to get in a lot of younger enrollees. And so it's sort of critical for the risk pool. And it costs the marketplace about 500,000 enrollees.
Really?
Yeah.
So, all right, I'm a single payer guy, right? And maybe someday we'll get there. That's clearly not what Obamacare is. But if you wanted to take Obamacare and repair it, and even Hillary Clinton, President Obama, they all said, yes, we could make it better than it is. Mm-hmm. What are some things you would do?
Well, I think one of the things that we heard when I was at HHS, you would hear people, from people out and around the country, just concerns about affordability for people not who are making in the sort of 250% of poverty and lower, because those folks, generally speaking, are pretty well insulated from price hikes because of the way that the tax credits are structured under the ACA. So essentially, because it sort of tracks with the second lowest cost, what they call the second lowest cost silver plan, because it tracks with the premiums themselves, when the premiums go up, the tax credits go up. And so it really insulates people from any type of big price hikes. And also it prevents...
So it's more middle class people who are...
Yeah, I mean, people who were at the higher end of the sort of middle class spectrum, but still maybe not, doing incredibly well. And I think one of the things that President Obama talked about this summer was the need to potentially expand the tax credits. So that's one idea. And I think the other thing is in areas where we've always had trouble with competition among insurers, and we hadn't had enough doctors, medical professionals. I think there's a need to increase competition, and one of the ways that he thought about doing that was to introduce a public option to let people buy into.
Yeah, which we should have had in the first place, I believe. And it was part of the original plan, as President Obama convinced me it was important for competition and for keeping costs down, and then dropped it as part of the debate. How about prescription drug prices?
Yeah, I mean, I think that's obviously that's been a big driver. One of the things that we have argued for and we put forward in budget after budget after budget was the ability for the Secretary of Health and Human Services to be able to negotiate drug prices. That's something that some of her counterparts around the world. It's something that they have the ability to do. We don't have it here in the U.S., and we think that we could put downward pressure on prices if you have the ability to negotiate.
So I sit there at the White House briefings, and I hear Sean Spicer say, he said it 3 times in the briefing on Monday, Obamacare is collapsing. It's collapsing. It's collapsing. And Donald Trump put out a tweet saying, or maybe it was just a statement, whatever, he told reporters that his advice to Republicans was, let Obamacare go another year, and it'll just implode. Any truth to that?
The CBO actually, in its report yesterday, took this idea head on and said that simply was not the case, that the marketplace was stable. S&P came out at the very end of 2016 and took a look at this coming plan year, and their conclusion was that the price increases that occurred last year in some states was a one-time correction, and that they saw that insurers were going to be making more money in the coming year, and so they felt like there was stability there. Again, one of the sort of important parts of how they structured the tax credit itself was so that when you had premium increases, the tax credit itself would increase as well. That prevents people from getting price out of the market, and that's what happens in a death spiral, is where you have increasing premiums and people dropping out of the marketplace, and because they can't afford it anymore, and you have adverse selection. And so, this is not happening in the Affordable Care Act. But that said, this doesn't happen by the marketplaces don't just run by themselves. It does take sort of care and feeding to make sure that they're successful. And so that's one of the things that we saw at the beginning of the Trump administration, when they took down basic marketing and outreach for the marketplace. That's important for getting people to sign up.
Right. Now, and I want to. So let's shift to the CBO report, but as part of that shift, I want to start with the fact that before the CBO report came out, the White House and everybody, Paul Ryan and his colleagues in Congress, were already slamming the CBO as not being a credible organization, because they kept saying, look at what they said about how many people would be covered by now under Obamacare. It was like 36 million or something, and it's only 22, right? So they were way, way, way off. How do you explain that they were so far off?
Well, on a lot of the key metrics, they were actually pretty close, and their track record has been pretty good. And I think that's been documented in numerous news stories, that they are among the closest in terms of the projections that were made. Obviously, they have to make some assumptions about what will happen in the subsequent years once you have this piece of legislation. They obviously thought that every state was going to expand Medicaid. That's going to have an impact.
Right. In other words, I think it's an important point. I was hoping you'd make that point, right? That a lot more people would be on if so many Republican governors hadn't said we're not going to allow this expanded Medicaid in our state.
That's right. And the other thing that I believe that they thought that there were going to be more people who would leave the employer-sponsored market, but that's one of the things we haven't actually seen, and that's also part of the sort of litany of dire predictions that have been made about the Affordable Care Act, that it was going to kill jobs. It's been proven that's completely wrong. It was going to increase the number of people who are working part-time involuntarily. That's been completely wrong. And one of the other things it says is that people are just the employers are going to dump health insurance for their employees. That was wrong.
Right. And one thing you have to say, too, is as far off as they were, the CBO was still a lot closer than the Republicans who said nobody's going to sign up.
Yeah, and that is actually one of the interesting things that you see, is that one of the projections that they made when they were looking at this was they looked at what the premiums would be over time. And, the premiums that they initially forecast were much higher, frankly, than what the insurance companies put forward. Now they're actually finally, the insurance company premiums are catching up with what CBO actually initially predicted. They're almost right on. Mm-hmm. And in terms of the subsequent projections that CBO made once they knew more about what was going to be going on in Congress and what the states were going to be doing, they've been pretty much spot on in terms of the number of people who have become newly insured.
All right. So the Congressional Budget Office has taken a look at the Ryan plan, or Trump Care, whatever you want to call it. What do they tell us about it?
Well, I think what they tell us is that the people in Congress, Republicans in Congress, have a very simple choice in front of them right now. And that is it worth it to you to give tax cuts to millionaires and corporations? Is it worth 24 million people not having insurance anymore. And we know that if we have that number of people who no longer have insurance, that is a life and death decision for many people. And they've had studies that have looked at mortality rates when we have increases and decreases in insurance, and a drop in insured rate of that size, we're looking at an increase of as many as 25,000, perhaps more deaths per year when you make this kind of change. And so there's a really stark choice in front of members of Congress. How much is it worth to you to give people who don't need tax cut a tax cut?
What happens to these people who lose their insurance? I mean, if they have a serious health care issue, they're going to go to the emergency room, right?
Yeah. Well, look, they're on their own, right?
They're on their own,
right?
Yeah.
And so what happens is people who do have health insurance, they're going to wind up paying for that because there is no free lunch here. There's no free health care, and so ultimately that's going to be a matter of for other people to pick up the tab.
Well, yeah. So I was getting at the point in between. They're on their own. They're going to not be getting regular doctor visits. They're more likely to get seriously ill.
Yeah.
And then they're going to end up in the emergency room, right?
Yes.
They're not going to be turned away.
We're going to be back to where we were before 2009, which is that people getting their primary care in the emergency room, which is not the place to get it.
Right. And somebody's got to pay for that.
Yes.
And the people who pay for that are the people who have health insurance.
That's correct.
So everybody else's rates will go up.
You're basically shifting the cost, and you're shifting it to people who have insurance.
I mean, we've seen this, right? We've been there.
Right. And, and this was I think this is a big part of why Republicans are running into so much, so many obstacles in this, is because the healthcare, the Affordable Care Act is really, truly part of the sort of fabric of our nation right now. People depend on it for their health coverage. And you're looking at stripping this away and fundamentally changing people's lives for the worse. And that's why this debate is so heated, because your health care, your health is so vitally important. And it's just obviously like a critical, intimate part of your life.
And we're talking about a pretty big chunk of the American economy, too. Here, aren't we?
Roughly 20%. We're talking about 20% of the economy without any hearings. We've had a quick markup, a bill that was drafted under lock and key. You compare that to the Affordable Care Act, which was online and available to the public for 3 months before the first vote.
Yeah. I mean, the bill was introduced on a Monday, and the first committee hearing was on a Wednesday, and nobody had read it. And
they're saying no negotiation, though that seems to be shifting now.
No, right. But that's another issue that we might get into. And there's also, it seems to me, there's a phony premise to this whole thing. Keep hearing Tom Price and others saying, no, but we're not forcing people to buy health insurance. We're giving everybody a choice. Everybody's going to have a choice. Well, isn't it true that given most people a choice, and they don't have a lot of money to start with, even if they could afford it, they're not going to run out and buy health insurance, particularly younger people.
That's completely correct. And I mean, you look at what they're doing with the premiums, right? So you're looking at, in the near term, you're looking at increases of 15 to 20% per year in the first couple of years. And then what Republicans have said now is, well, look, but you have to look farther out, because once you look farther out, then you see that premiums are coming down. They come down 10%. What they don't tell you is that the tax credit is cut by 50%. So while, yes, the premium may ultimately go down a little bit, the tax credit that you get is cut by a much larger margin. So people aren't going to be able to afford it.
I mean, it just seems to me if I'm making $26,000 a year,
right,
and that's not going to go very far when it comes to paying your rent, paying a car, making a car payment, buying clothes, buying food. I'm unlikely to put $2,500 or $2,000 or whatever it is into health insurance, especially if I'm feeling pretty good.
Right.
And I'm 21, 22. What the hell?
Yeah.
I'll wait until I get old and get sick.
Right. And I think there's...
And then...
and then you're really screwed.
Yeah. And I think that there's a real question about whether the structure that they have set up to try to encourage people to get coverage, whether it will actually work. I think a lot of people think that it won't. It's a 30% surcharge if you don't have insurance. I think a lot of people, a lot of younger people will look at that and say, "It's not worth it to me. I'm going to take the risk." because I'd rather do that. But I think if you look at what happens, particularly with older Americans and people in rural areas, essentially a lot of the Trump voters, these are the people who are going to come in for the harshest treatment under this plan, because for older Americans, you're going to see your premiums increase 5 times. They allow the insurance companies to charge you 5 times more than what they charge younger people. But meanwhile, the tax credit that's available to you, they change the structure of the tax credit so it's no longer based on your income. It's only based on your age. So they do bump it up a little bit if you're an older enrollee, but they don't bump it up to even come close to making up all the ground necessary when you're being able to be charged 5 times more. So if you're an older American, particularly people in rural areas, because one of the other things the Affordable Care Act does is it increases the tax assistance or tax credit assistance that's available to you. Mm-hmm. If you are in a rural area or a high cost area, is geographically based and also in addition to being income based, that all goes away under the Republican plan. So if you're in a rural area, if you're an older American, you're going to come in for really rough treatment from this law.
Are the insurance companies behind this Ryan plan?
So far, what we've heard from AHIP, which is the big trade organization of the insurance companies, they have serious concerns about it and have expressed their opposition. That same goes for doctors and nurses and essentially every other expert in the healthcare industry. They all think that this plan stinks. There's very few people who think it's particularly good. They're really only Paul Ryan and a handful of other people in the Republican leadership. Right.
I said to the top, I'm not sure that Donald Trump has read this plan. I find it strange that Trump would be at least pretending to be so supportive of this plan, because if you, as we all did, listened to and heard what he said about health care during the campaign, he didn't sound like a Republican at all. Sometimes he sounded like Bernie Sanders.
Right.
But one particular point that he made, in addition to saying, I'm going to cover everybody and they're going to have cheaper, better plans and not pay as much money for them, he said specifically, I'm not going to touch Social Security, Medicare, or Medicaid.
Yeah, he breaks that promise.
Yeah. Talk to us about Medicaid under the GOP plan.
Well, they're going to roll back the Medicaid expansion, of course. And so, for new enrollees.
So all these new people who might come on under a different threshold, that's gone. That program's gone.
That's correct. It's gone.
How about the people who are already in?
Well, I think it's one of the things that's important to understand about the Medicaid population itself is that there's a tremendous amount of churn in that population. So you have people who are coming on and off of it all the time, who are getting jobs with health insurance, losing those jobs, and then having to come back into Medicaid. So those people who, when they came back, they would no longer be eligible. I mean, Arizona at one point froze enrollment for adults, and in the span of 2 years, the change in the population was about 70%. And so, the federal government will no longer go to the same sort of matching level, the current federal matching level for those new or returning enrollees. And so what that's going to mean, it's going to create an automatic trigger in 7 states that say, once the federal match goes away, once it goes below a certain point, they end Medicaid expansion. So they go back to, they no longer cover people between 100 and 138% of poverty. And it's going to ultimately force the states, the rest of the states, to do the same thing, because they're just going to find it to be, fiscally impossible to be able to.
So my understanding is, at some point then, maybe it's 2020, the feds say, okay, here's what we're going to give you per Medicaid recipient, period.
Per capita cap, right.
Per capita cap. Mm-hmm. And that's going to be it, right?
That's right.
As costs go up, whatever, but that's it. So states will be limited in how many, and they decide how many more people they take, right? They're going to be limited in how many people.
It's going to lead to it will lead to rationing of care, and you're going to be in a situation where states are going to have to decide, who gets this. I mean, is it seniors who rely on Medicaid for nursing home care? There's a huge percentage of seniors who do rely on it. Will it be people with disabilities? Will it be children, working families? Who's ultimately going to lose in that? And one of the things that the way that it is right now, where you have a guaranteed benefit for everybody who qualifies, when there is a major public health emergency like Zika, or you have a crisis that we have right now with opioids, for instance, Medicaid is essentially there to fill the gap, to be able to help states afford to be able to meet these challenges head on. With a per capita cap, that ability is gone. And so who winds up picking up the tab? It's going to be the states. And the states then are going to have to decide ultimately, how do we ration that care? And that's going to be a situation where you're going to be endangering people's lives.
Right. Is Medicare impacted at all?
I mean, there's there are, I think there's some concerns about what it does to some of the trust fund there. But I think not nearly as severely as Medicaid.
Medicaid bears the direct brunt here. Right.
Yeah, Medicaid bears a direct brunt, and then lower income families who rely on the tax credits.
What is the population on Medicaid? I mean, it's pretty.
Medicaid is 74 million people.
Whew. Right. And all of them in one way or another are going to be impacted.
Yes, because I mean, they certainly stand all to be impacted. You have seniors, you have people with disabilities, new moms and their babies, and lower income people.
I don't think anybody has really sold out explain the whole impact of this bill. Again, I can't believe that the people, either Trump or the people around him, understand its implications. So here's a question. I mean, you've got so much information on this, and just based on the facts, how bad this plan is. What can you do about it? What are you doing about it? Are you just a lone eagle out here trying to get out the word? Are you part of an organization? Is there any organized effort to let the American people know how bad this bill really is?
Yeah, I think there are advocates who have been working on healthcare reform for decades,
right?
Who are part of a coalition. I'm working with the Protect Our Care Coalition right now, which includes SEIU, families, the Center for American Progress, a number of different organizations that are out there working every single day to try to educate the public about what this bill does and why it's important to oppose it, and why it's important to speak out.
Yeah.
People can't let up because it is having an impact. They need to continue going out to the town halls. They need to continue calling their members of Congress and telling them that this bill, they should not be voting for this bill. And if their member of Congress is expressing reservations or says that they aren't going to be voting for it or are certainly leaning toward not voting for it, to then call in and encourage that sentiment. To make sure that there's positive reinforcement if you feel like your member is moving in the right direction.
Right. I mean, we see the town halls did have an impact, right? And
yeah, they've said it themselves that they've had an impact. Absolutely.
Right. Some people have come back and said, based on what I heard at the town hall, I can't vote for this bill or whatever. So Protect Our Care is the umbrella organization.
That's right. It's an umbrella organization. And there are people who have been working on this issue for so long, and all of them are part of this organization. And then there are a number of people who have been as part of HHS or have been in the administration or with CMS or and other campaigns who are working on this.
And does Protect Our Care have a website?
We have. What I would encourage people to do is to go to the websites of people like this Center for Budget and Policy Priorities, who are following this really closely and sort of have this sort of real trove of information on this. SEIU, others who are part of the Protect Our Care. That's where I would encourage people to go.
And Peter, the organization that we've had in so many times,
Families USA.
Families USA,
Absolutely,
right?
yes.
They've been on the front right from the very beginning as well. I'm sure they're part of the coalition.
They are.
But I think it's so important to get that word out. And also, and we could see, yesterday members of Congress, Ileana Ross-Layton from Florida, coming out saying there's no way I can support this bill based on my population. We're going to be joined next by Congresswoman Jackie Speer from California. We'll have her advice too on, and she's told us before how effective hearing from constituents is on members of Congress. They do pay attention. You are doing great work out there with just getting out the facts, Kevin. We appreciate your time with us this morning. Thanks for coming in. Back with Congresswoman Jackie Speer here on the Bill Press Show, Wednesday, March 15th.
This is the Bill Press Show.